You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoy the podcast, please listen, subscribe, like, and share it with friends. Thank you.
Hello, this is Richard Jacobs with the Future Tech and Future Tech Health Podcast. I have Erin Elliott. She's a dentist, and we're going to talk about snoring. In particular, I've been doing a series on snoring and sleep apnea and all kinds of other sleep problems, and part of it's selfish because I've had them for many years, and part of it is to help you, the listener. So, Erin, thanks for coming.
Thank you for having me. Any chance I get to talk about some snoring, I am all about it. It's such a common problem that people think is normal or they learn to live with it. And so I want them to know that there's options and possibly deeper going on.
Yeah, how do patients approach you about snoring, or do you somehow know to approach them? Like, how does it work, and what do they tell you?
Yeah, it often, when I first started 10 years ago, I would get looked at like I had two heads when I asked a dental patient how they slept at night and if they snored. And I think it's becoming a little bit more commonplace for dentists to be screening for this, but there's a lot of dental signs and symptoms. And traditionally, if I had you close your eyes and imagine a sleep apneic or a snorer, I know what you would have in your mind, probably an old fat man. But really, it is anatomical. And so there's dental signs and symptoms, like I said, that I can identify, and really the mouth gives us a lot of clues as to what could be happening. For example, even simply grinding their teeth. A large tongue, it's called a scalloped tongue. A small chin. So the list is like 30 or 40 symptoms long, but once I can identify those in a dental patient or my hygienist does, then we start a conversation.
Okay, and then I'm jumping ahead here, but when you talk to people and you say, hey, you have certain signs that may tell me that you may snore, what are the patients saying? Or again, are they bringing it to you? Like, what percentage of the time do they come to you versus you say something to them?
So for a traditional dentist, I know more patients are asking them, but really it's me bringing it to them. I've been doing this long enough and am established in the community that physicians are referring, or existing patients are referring their family and friends. So I am a little odd in the fact that people are seeking me out just for this. But most of the time it's us identifying it in them. It's, coming through our traditional hygiene flow. And so when we do bring it up, it's funny because if you ask a man, do you snore, every single time they say no. So I've actually stopped asking that question. I just say, hey, has anyone told you that you snore? And then I really kind of get the truth. And then for women,
you don't know.
Yeah.
You don't know. I've laid on the bed, and if I lay on my back, I do, and I'll wake up, and my son will go, Dad, you're snoring. And I have no clue because you're asleep.
Yes, exactly. And so the denial is huge. However, smartphones and video cameras have kind of helped some of that. But I would tell you that I didn't snore until my husband did videotape it and put it on social media. I couldn't deny it anymore because, I'm a young, kind of thinner female, and there's no way that I could snore or have sleep apnea or anything like that. So it's been a journey for sure. And women, they snore too, and so they definitely seek help because to them it's more embarrassing, and so they seem to be in less denial about it.
Yeah, and I read a stat, I think it's AASM, that said like 25% of couples don't sleep in the same bed, or they start out and then they don't finish sleeping in the same bed. So it affects relationships a lot. It's embarrassing. I remember like traveling with my family years ago, and I thought, oh no, I better get 2 hotel rooms. I don't want to keep them awake all night. My wife said it's okay, and I was like, no, we got to do it. And it can be a huge impact if, for instance, a couple doesn't sleep together. They could think, what's the other one doing? Are they texting or watching porn, or will the relationship fall apart? So, I mean, it's a big deal, Who knows?
Yeah, and it can get expensive, especially, if you go on a cruise. Those are really cramped quarters, and 2 rooms would be a lot. And it's interesting. I actually had a patient who was a marriage counselor once, and she's like, oh, my gosh, like I need to refer a lot of my clients to you. Because, if you're not sleeping in the same bed, you do lose some of that intimacy and just time together. And it's not normal. I went to do a lunch and learn at a physician's office, and the nurses came up to me. They're like, I think I need to come see you because my husband and I have been sleeping in separate rooms for 5 years. I'm like, how? Like, we have options. And snoring, I honestly believe, and it's from a lot of years of experience too, that I'd say 90% or more of chronic snoring really is sleep apnea or some sort of sleep. So it's interesting, I know you're a tech podcast, and I get so many of those Facebook feeds and Instagram stuff about all this anti-snoring stuff. And I think some of it is gimmicky and some of it might actually help, but I think what that tells me is that people are looking for a simpler solution, and they want to do something to help appease their bed partner.
Yeah, so physiologically, what's going on when you snore? What causes it? What happens when you snore? And then we'll get into remedies after.
Well, really, snoring is noise, right? It's vibration of soft tissue. And that can be caused by many things, like soft tissue in the back of the throat, like an elongated soft palate, large tonsils. It also shows a narrowing of the airway. Like if you could imagine trying to breathe through like a coffee stirrer straw, there would be some turbulence there if your airway is narrowed and collapsing. And that can be caused by the tongue falling back, the soft palate collapsing. Those are the usual culprits. And then there's snoring that can be nasal. A lot of times when we treat a patient, which we'll get into treatment options, if they do have residual snoring, then that's where we look nasally. And that could be a valvular collapse. It could be large turbinates, it could be polyps, or just a narrow nares or noseway. And a lot of those things can cause snoring. And a lot of people will say, I snore just when I'm sick or have allergies. And that shows that the tissue in the oral cavity is more swollen than normal. So it becomes more vibration, more swollen, less taut.
Right.
And then some people say they snore just when they're on their back, and that's because the tongue falls back and their mouth usually drops open. And then some people say they snore only when they drink. And that just allows, really what alcohol does is it's like a sedative, so it just relaxes the muscles so much that there's narrowing of the airway as well as there can be swelling there as well.
Yeah, and from what I understand, in REM sleep, that's when you have total collapsibility. I guess everything relaxes completely, so you're more likely to snore at that stage of sleep than deep sleep, right?
I didn't want to get too technical, but I thought about mentioning that. You really have done your research. Yes, REM sleep, it's interesting because our body is essentially paralyzed. Otherwise, we'd act out our dreams. So, yeah, the muscles are at their most vulnerable and relaxed position. So we do see an increase in snoring as well as sleep apnea in REM sleep.
Have you seen a pattern in tooth decay or staining of the teeth or mouth morphology or anything like that in snorers versus non-snorers?
There is, but I haven't seen like research per se on it. But most sleep apneics or snorers usually breathe through their mouth, And saliva really is kind of the best mouth rinse we have. And if you're breathing through your mouth, plaque dries out. Saliva helps clear plaque. It helps neutralize acids. It helps clear food particles and food debris. And if you have a mouth breather, then the plaque and bacteria just kind of stick to the teeth. And you have a buildup of tartar and stain, and that's how decay can happen as well. And then we see like gingivitis on the front gums, and that's a common sign of mouth breathing, which tells us that there's an obstruction, because really, we have a nose for a reason. It does so many things for us, but if it's obstructed or blocked, then we're more prone to snoring and sleep apnea.
So it sounds like snoring can be caused maybe by a wide tongue or a large tongue, or a tongue with poor muscle condition, or a pharynx with poor muscle condition, or perhaps if you're overweight as well and there's fat deposits, or deviated septum, or allergies, or dozens of possible ways for it to happen. Right?
Yeah, and that's the thing, is helping identify that. With weight, it's interesting because fat doesn't, it really can impact the airway. For every 10% of your body weight that you lose, it can reduce the sleep apnea severity or even snoring by a significant amount. But it's also anatomical, like I said. It's also physiological. Your muscles could just be more collapsible. So there's a lot of factors going into it. Is it nasal? Is it from further down? Is there collapsing going on? Is it actually sleep apnea? So you're right. It's identifying the cause is the best way to treat.
So now the range of treatments. What do you typically do? And I know it depends on what the cause is, but what are the possible treatments?
Traditionally, kind of in the medical world, they used to, but especially back in the 90s, there was a lot of things to treat snoring. And what that tells me is that a sleep study is not done first. And I think it's vitally important to test airflow before working on snoring to see if there's a collapsing of the airway. Saying that, surgically, there was a lot of surgeries done in the 90s where they cut out the soft palate, part of the pharyngeal wall, which is like the curtains of the throat. It's the side walls, as well as the uvula. So it's called a uvula pharyngeal palatoplasty. The problem
horrible.
is it's about 30% successful. It does reduce the snoring, but not necessarily the collapse. And then they used to do this thing called palatal, like pillars, where they, since snoring is vibration of soft tissue, they put these kind of stiff rods into the soft palate. The problem is the body would reject them, and they would eventually work themselves out almost like a splinter would. So that wasn't effective. And so there's nasal surgeries that can help reduce snoring. Again, finding the cause. Is it a deviated septum? Is it large polyps or turbinates that are even causing the problem? So I think people are kind of like throwing darts out, like, okay, is this going to work? Is this going to work? And then, weight loss can reduce severity. I don't know if it completely eliminates it. If you lose weight, you might, go down to a more mild snoring. You can gain and lose weight in your tongue. And to me, a lot of snoring is the fight for tongue space and the prevention of that tongue falling back and collapsing the airway. Then sleeping on your side, there's a lot of gizmos and gadgets for positional therapy, it's called, where it forces you to sleep on your side. Stopping smoking. Lifestyle changes do help, not just weight loss, but stopping smoking and no fun in life. Not that I smoke. And then there's the CPAP, which essentially stands for continuous positive airway pressure, where it's a reverse vacuum and it's just blowing enough air to blast open the airway and move soft tissue out of the way. And then now oral appliances have been around for a long time, but they're now becoming more commonplace. And what it does, and you see a lot of the internet ones as well, but by posturing the jaw forward, you can, the tongue muscles and the throat muscles are attached to that lower jaw. And so by bringing that forward, you create a more open airway. And if there's more open airway, there's less turbulence and less vibrations and therefore less snoring.
If you look at let's say 1,000 people you've seen that snore, has anyone taken the time to sort them into categories? 45%, it looked like it was the pharynx, and 22%, it looked like it was a deviated septum. Has anyone done that? Because maybe you'd see a predominance,
I bet there is. I wish I knew the stats on that. I could probably Google it later. But there's something called DICE, and it stands for drug-induced surgical endoscopy. And essentially, they put you to sleep, and then they use a scope to find out where the collapsing is going on. So yeah, they mimic sleep to see what's going on. So the biggest collapsing area is the tongue and then soft palate, and then there's the lateral walls and then the epiglottis. As far as snoring goes, they're looking for collapse. Now, as far as how much snoring is coming from the nose, I don't know the stats on that.
If that was known, and then you correlated the treatments and their efficacy, I think that would be a big step forward.
Yeah, the problem is getting ENTs to do the drug-induced endoscopy, because insurance won't pay for it. So, the patient has to be really motivated, and there's just not any ENTs in my area that do it, but there are some specialists in the bigger cities that do it. Because I think that does totally customize and tailor the treatment to the patient. And even if with the stats, it's still totally hard to know for sure where that collapsing is.
So what's the, you talked about some surgeries, radical ones. What about the other side? Home remedies, take singing lessons, play the didgeridoo, do tongue exercises, myofunctional therapy, things like that. What's your opinion on that side of the coin?
I think all of those things help reduce severity. Curing is a really strong word to me. And so, by the way, there's other surgical options, and if you basically have an oral surgeon on your team, you can essentially advance the upper and lower jaw. And I want to mention that is like 90% successful. And so if you are like wanting to cure this and just take care of it permanently and not have to have a machine or an appliance or a gizmo, that surgery is the most effective. It's essentially changing the anatomy so that you get a bigger airway. But all of those other things.
Question about that. How do you move the jaw forward? What's that surgery like, by the way?
Oh, so I don't want to go into too much detail because I've witnessed a few, and it sounds brutal, but the patients are actually in a lot less pain than they thought they would be. But you kind of saw the upper jaw off of the base of the skull and split the lower jaw and advance it about 10 millimeters.
Okay. Gotcha.
Yeah, but I mean, it's effective. It can be curative, and it's really not as painful as people thought it would be.
Okay, and then again, a little bit more commentary on the home remedies, I'll call them. You said you think they'll improve, but what else do you have to say about them? Singing, didgeridoo, etc.
Well, what the didgeridoo and the upper airway exercises do is improve muscle tone. And so again, it definitely improve the airway, help you keep the airway open at night. What I mean by not curative is without really testing it afterwards, I think, like I said, it could help keep the airway more open and less collapsible. But sometimes there's just some anatomical issues that no amount of working out will change.
Has anyone looked at the microbiome of the nose or the throat as it relates to snorers? Anyone even thinking about that?
There could be. Not that I know of.
Okay, I'm just wondering. All angles here. So what is the near-term future of fixing snoring? What do you see that's here, that's the latest and greatest, or that's about to come out that you're looking forward to?
What I like the most of what's going on right now is that more and more people are aware of it, not just the medical world. I'm in a smaller town, and so in the smaller town of Coeur d'Alene, so I'm able to gain access to physicians and kind of spread the message. But what I like is that the consumer is more aware and the consumer is more willing to do something about it. And I think it's because they didn't have a lot of options. The other thing we didn't mention is Inspire. Are you familiar with that?
I forget, but I know I've seen the acronym, but I forget what it's about.
Yeah, so Inspire and more insurances are covering it, but what Inspire does is it's like almost like a pacemaker that they put in under the ribs, and then it has like a lead that goes to your tongue, and if your tongue collapses back, it kind of zaps the tongue to bring it forward. So really, I don't think there's going to be a magic bullet, except what I think is could be the most important switch or change is if we as dentists can get the message out and help shape and grow the anatomy of a child, meaning catching snoring in kids, thumb sucking, mouth breathing. We are trying to screen our kids at a younger age, even 2 years old, to help grow and develop the jaws forward, broad and wide, so that there's less constrictions and less anatomical issues contributing sleep apnea and snoring.
That brings up something important. Braces and snoring. How have you seen it affects people, teenagers essentially that get braces, 10 to 15, 10 to 17? Is there any correlation there on what it does?
I don't think it creates snoring having braces, but I think if we get to kids when they get braces at 12, 13, that's too late. The teeth have already come in, and now we're trying to sort them out. But if we can grow and develop the jaws so that there's room for the teeth and get the child breathing through their nose, I think that is better. So a lot of times we're straightening the teeth within the context of the jaws they're fully grown by then, really. Our head and neck is kind of fully grown by like 10, 12 years old. And so we try to get the growth spurts earlier. I don't think braces contributes to sleep apnea. I think that we are doing less extractions of teeth and pulling everything back and crowding the airway, which is good. But I think that if we could get the orthodontists and braces on kids, we could see better, less adult sleep apneics and snorers.
Okay, but patients that get braces, does it improve snoring or?
Not necessarily. Really, by then the braces there's not a ton of expansion going on and creating more room for the tongue. It's more just straightening the teeth of where the jaws already are.
Okay, all right, very good. So what's the best way for people to find out more? And, if they're near you, to come see you, but otherwise, how can they find out more to help themselves if they suspect they snore?
The AADSM is a good place. It's American Academy of Dental Sleep Medicine. I actually would love to help answer questions too. I happen to know dentists almost everywhere. So my personal email address is Erin Elliott, DDS@gmail.com. It's 2 L's. And AADSM has a lot of good information, and even the American Academy of Sleep Medicine would. And there's even, snoring or sleep associations and that sort of thing. But the great part is I think there's more awareness, and I appreciate all you're doing to help with the awareness as well.
Okay, Erin, well, thank you very much for coming on the podcast. I appreciate it.
Thank you.
You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and share it with friends. Thank you.